The following program is brought to you by Naleo TV, the People's Platform. This program is freely available to the public, thanks to the generous funding from Hui Pohala and the Hawaii Department of Human Services, MedQuest Division.
In our previous episode, we explored how does one sign up for palliative care and what will the first visit be like. Joining our discussion was Kiana Foster, Clinical Operations Manager for Hawaii Care Choices. Her message was to make the connection with your physician or Hawaii Care Choices team right after diagnosis to get the support you need at home early, keeping patients out of the emergency room in the comfort of their own homes is a direct result of receiving palliative care. We were also joined by Cheryl Paval, nurse practitioner and palliative care specialist, also with Hawaii Care Choices. She shared how easy a first visit to a patient's home can be. Besides evaluating the patient's health, one of her priorities is to educate the patient and caregiver about the disease process and ways to respond to the symptoms at home. Also, the importance of having goals of care plan to keep everyone on the same page regarding the patient's care at home. Aloha and welcome. I'm Lonnie Weigert, your host for Let's Talk Healthcare Hawaii, a new healthcare series to help our community navigate through the many challenges of acquiring quality healthcare for those living with a serious illness such as cancer, congestive heart failure, COPD, kidney, lung, and liver disease. So ho'olohe, listen up, especially those caring for a seriously ill relative. You will not want to miss a single episode. If you've never heard of the term palliative care, don't worry, you are not alone. The goal of palliative care is to prevent visits to the emergency room, boost the quality of life, and relieve suffering from chronic illness and treatments such as chemotherapy, radiation, dialysis, and surgery. Whether you're new to palliative care or not, this series is designed to raise your awareness on the benefits of receiving palliative care at home. Palliative care is available to all ages, including infants and children. In this episode, we will explore how palliative care boosts the quality of life. Are you or someone you know living with serious illness, such as cancer, congestive heart, or kidney failure? Are you seeking treatments for your chronic illness and wishing you had more support at home? In this episode, we welcome registered palliative care nurse April Cao, who will answer questions regarding her specific role in helping you, the patient and caregiver, manage the discomfort from treatments and symptoms caused by serious illness. Through education, April can reduce worry and anxiety by providing the knowledge you'll need at home. We also welcome Laura Dvorak, licensed clinical social worker, who will share the additional support and community resources available but unknown to most patients and caregivers in the community. We have lots to unpack. Makau, you ready? Let's get into the episode. Aloha, April. Thank you so much for being my guest today. I have quite a few questions from the community with regard to what you do. So can you explain to me, what does a palliative care nurse do, and what can I expect if, you were to come over to my house and visit because you're taking care of my mom?
That's an excellent question. So, I come over and first of all, I sit down with you and we talk stories. We say, how have you been? How are you feeling? Are you having any symptoms, any pain, any trouble breathing, any trouble going to the bathroom, any trouble sleeping, that kind of thing? And I want to know just all about how you've been. And that's not just physically. I do want to know physically how you're doing. But I also want to know, how are you doing? How, is there anything big going on in your life that I need to be aware of?
So these are questions that you would be asking my mom while I'm sitting there with her. Okay, pretty much my mom would be able to answer any of those questions. Tell me, why is it important for you to to know all of that?
Well, this is part of how I can assess. It's part of my assessment. It seems like we're just chatting, but this is how I assess how are things going for you. You know, are you having trouble, or are things going pretty well right now? So we start there, and then when we've talked about everything there is to talk about, I whip out my stethoscope and my blood pressure cuff, and I take a listen to your heart and lungs. We get a set of vital signs. And, you know, we make sure that everything is doing okay in that area.
You know, I really like your vibe. It's very calming. And why that's good is because my mom would freak out that strangers are coming over. You know, we have to know who your family is and all of that. But what's really nice is we're able to just kind of warm up to the whole idea of someone's coming to visit. And so how often would you visit?
You know, I see most of my patients about once a month, but it really depends on how they're doing and what, you know, we work together to decide how frequently I should come. So for some people, they're in a period of time where they're doing really well and they feel really confident in managing, you know, their health. And so they say, you know what, I really enjoy seeing you, but, you know, why don't you come every other month? Or, you know, why don't you come every 6 weeks? And so then that's totally fine. Some people are struggling. They're having a period where they're having more trouble with certain symptoms. And, you know, I might come and visit them physically once a month, but maybe I'm calling them on the phone in between to say, hey, you know, you were having a little bit of trouble breathing. The doctor changed your medicine. How's your breathing going right now?
Oh, my gosh. That's so just all that you just told me right now just gives me a lot of hope and confidence on, you know, not blowing it with my loved one, because, you know, this is one of the things is if my mom doesn't eat, you know, I'm concerned that, you know, you're not eating enough, Mom. That's why you're getting weak and all that. But is that a symptom of maybe her illness as well? That's why she doesn't have an appetite?
It sure can be. A lot of diseases, unfortunately, as they progress, people lose their appetite, they lose weight. Sometimes food doesn't taste very good, either because of the illness or because of the treatment sometimes, you know, if you're getting chemo or something like that. But, you know, one of the things we can talk about is how can we get you eating foods that are appealing to you? What are some ways you can add extra nutrition to the foods that you're eating to kind of stem some of that weight loss, right? What are strategies that we can do? That's part of our symptom management, yeah. Sometimes a loss of appetite and you know, rapid weight loss can be signs of a more acute illness, right? A problem that needs to be addressed. And so if it seems like that's the case, then that's where we're saying, okay, you need to go in and see your doctor and talk about this because this isn't normal.
Now, I know there's a lot of viewers who are watching that their elderly loved ones, they're home most of the day by themselves because most of us are all working. What would you say with regard to making sure that they get the proper care for them during this time that they're all alone?
Yeah, so that's definitely something we can talk about. What are strategies to make sure that they're taking their medications when they're supposed to, that they're eating when they're supposed to, that they are doing all those things? You know, is it time to look at bringing in extra caregiving to the home, which is something that our social workers can help with, identifying resources to get some extra caregiving. A lot of people use technology to kind of keep an eye out. They might have a camera in mom or dad's home where they can monitor them throughout the day and kind of peek in and make sure everything's okay.
That's really a good idea. So from all of these things that you're sharing with me, it sounds like you'd basically be teaching us how to take care of our illness.
That is 100% correct. One of my biggest roles is as a teacher, you know, teaching how to manage the symptoms of your illness. If you're having trouble with pain, if you're having trouble with breathing, if you're having trouble with swelling, you know, how can you do your best within the confines of that illness? How can you do your best to feel your best? You know, talking about what are these medications for that you're taking? Are you taking them the way that you're supposed to be taking? I've had many patients say to me, I never realized exactly what this medicine did and why I was supposed to take it. And and when I was supposed to take it and how I was supposed to take it. And so we can spend a lot of time, and sometimes that information doesn't take on the first conversation, right? So the lovely thing about this program is I come back every month. So if I come back next month and I see that information didn't quite, take, then we can talk about it again, and we can try another approach to how to make sure you're taking the best care of yourself that you can.
This is so wonderful because it all is very confusing, and the medications with the pill box, and we got to fill this, and it's just really crazy because we're getting medication from our primary care, and then we go to urgent care, they give us something else. Maybe I had to take mom up to the emergency room. It's really mind-boggling. So you would come and help us set that so that we're not taking more than mom needs to take.
Right. Well, we review every medication that you're taking, and we'll say, oh yeah, this is how this should be going. How are you remembering to take the medications every day? Would it help to have a pill box? Who can set up your pill box? Who makes sure that that you're taking what you need to take? And sometimes we'll look and say, this medication doesn't make sense to me in the context of what's going on. And that's when I get on the phone to your doctor and say, I just wanted to clarify that this is something that you still want them to be taking. Or is this the right dose? Do we need to go up on the dose? Do we need to go down on the dose? Unfortunately, our healthcare system is fractured in many ways, right? And so we can sometimes spot the things that get lost in those gaps between maybe the hospital and the PCP, or the PCP and the specialist, and help navigate through some of that.
I really appreciate that you would be an advocate, a cheerleader for us, because honestly, we don't really know what the doctor is saying to us a lot of times, because he or she is just saying it very quickly, and then we don't really understand. As my last question, I just wanted to ask, do you have a short scenario of how somebody wasn't doing so well, but then you came in with palliative care and how you were able to change their outcome?
Yeah, certainly. I have, a patient that I'm thinking of who lives by himself. He has his own apartment, and he doesn't have a caregiver, and he had been on Oahu for surgery. And the surgery is anticipated to be a quick recovery and a fairly simple procedure, but things went wrong during the surgery, and it was more complicated. He ended up having to stay for quite a while. And when he came home, he was having a lot of trouble trying to, remember things like going to the doctor and remembering to take his medication. And there were, changes that he was having that were that were concerning, right? And so I was able to help. We talked about ways to remember to take medications. I would sometimes, call him on the phone because he didn't have anybody else to remind him that it's, your doctor's appointment is tomorrow. Don't forget to go. When he was having one of his medications was making his blood pressure very low in the afternoon. But when he would go to the doctor, it would be normal when they would check it. And so I was the person that said, well, yes, it's normal right now, but I know that, at 2 p.m. when you check your blood pressure, it's too low and you feel dizzy and you feel sick. And then the doctor said, oh, well, then we need to change the dose. And so that was something that he didn't think to mention on his own because it's intimidating to be at the doctor. There's all this stuff happening, and then when we were back at home, I was the one who could say, remember, the doctor said you needed to change, are you taking 2 pills instead of 1? And, oh, yeah, he did say that, didn't he? So, I could help with the translation and with some of the reminders. This is what we talked about when we saw your doctor. These are the suggestions that she had and help with that communication.
April, thank you so much for joining me today and providing that really valuable information. Thank you again. Mahalo for coming.
Thank you so much for having me, Lonnie.
Aloha.
Aloha.
Mahalo to our palliative care nurse, April Cao, for that helpful information. Having someone so calm and confident like April will definitely put a lot of caregiver minds at ease. It is our honor to now welcome Laura Dvorak, licensed clinical social worker, to our discussion. Aloha, Laura. Aloha, Laura. Thank you so much for joining me today. I have a little of questions for you from the community, and I just wanted to just jump into the first one. So, the first question that I often get is, what is the main purpose of the palliative care social worker? What actually do you do with regard to the whole program?
So that's a great question. Thank you. So the social worker on the team really helps the patient and the family or the caregivers kind of learn how to cope with the changes that they're going through with illness, with regards to getting resources.
So you're part of the Kupu Care team.
Mm-hmm.
Okay, so Kupu Care is palliative care.
Yes.
Ah, okay, perfect. All right, so you're going to be somebody that actually comes to the home.
Yes.
Okay.
Yep. Yeah. So we visit the home. The frequency is kind of determined by the patient needs and guided by the provider on the team, the nurse practitioner. But yeah, we're there to help with anything from just assessing the situation, like are there conflicts going on in the family? Is there food insecurity? Are they not being connected to resources and programs that are available?
Wow, that's a whole nother side to the medical world. It's almost like you're bringing in the human side of healthcare, which is really cool. Okay, so talk to me about the wishes and values and all of that really is important to the patient. How do you make that come to life for them when you come to see them?
Well, I take time in just building relationship with them. Just making sure they're comfortable with me and they understand what my role is too, because this might be the 5th time I'm having a conversation like that this week, but it's the first time for them. So just remembering that, bringing the humanity.
So give me an example. Like, you're obviously not somebody that's coming to clean the house,
right?
But you're somebody that is doing what?
I might be there to help them with advanced healthcare directives.
Okay, if they don't have one.
Mm-hmm.
Okay. If they're having any kind of conflict with their family, is that okay.
Yeah.
All
yeah.
right.
Just giving them a space to vent, maybe even giving the caregiver a space to vent, because a lot of caregivers are experiencing strain, stress that they might not even be aware of.
Let's tap on that a bit, because I think in our community, we just take it, for granted that, when somebody is getting old, then the kids are going to take care of them. But meanwhile, the kids are having full-time jobs, et cetera, and now they're trying to figure out who's taking care of their elderly loved ones, and there's a lot of stress because they still got to feed the kids and wash the clothes and all of this. Tell me, how do you come in to help them with that process?
So, we might just come in and ask how people are functioning, if they're getting enough sleep, if they're getting enough breaks, if how's your mood been? And well, actually, I've noticed it's not great. I just stay busy. I don't think about myself. A lot of the answers I get. And sometimes it takes a while for families to warm up to the idea of someone else coming in, like a stranger coming in and maybe doing hands-on care.
Yeah.
So sometimes just bringing up the idea and then just checking back in about it and seeing where they're at. And hopefully not letting it get to like a breaking point or a crisis before they're willing to receive some support. Yeah.
So on the food insecurity, so if an elderly loved one is at home and they probably don't have enough food, to keep them nourished, what would you do about something like that?
So I would probably first see like in the immediate sense that week, I would see if there was any, we have a food pantry that we draw from through the food basket. And then I would see if there was any other resources available, because you want to kind of like first address the immediate needs and then kind of look at week to week, how do we set them up for getting the nourishment that they need? the nutrition that they need. So I would look and see if they would qualify for SNAP benefits. The Hawaii County Nutrition Program is a wonderful program where
Would you also help them if they wanted to sign up for Medicaid or Quest?
yes.
Oh, okay. So you'd be able to help them with that. That's really, really great. All of this support and just resources that you bring to a family is so invaluable. Thank you so much, Laura, for coming today and sharing that just tidbit of very, very valuable information. We hope that our families will call us directly and get more information if they need it. Thank you again.
Thank you for having me.
Aloha.
Aloha.
I am so honored to introduce Kingston Akaka, a resident of Hilo. He shares how palliative care has helped him and his family. Let's hear from Kingston.
My life before Kupu Care was a little bit hectic. It's like, I didn't know where to navigate. I had no idea how this was going to work out for me. I had a triple bypass and a mitral valve replacement, which pretty much rendered me like disabled. And I really didn't know what I was doing until Jason and Haley came, told me what the program is about, and they told me how they would help me. So I'm on the palliative care. And palliative care, to my understanding, was when you need the help from your prior operations or stuff like that, and it's affecting your life in a way where you need some little help getting your appointments, and with in-home care comes and stuff like that. I was going in the direction I needed to go, but they were there to help me in my appointments. They come to my appointments. They keep track of all my vital signs and stuff like that, So if they weren't there, I may have, slacked off a little bit on those kind of things. Because there have been times where I just was feeling good enough to say, I don't need to take the medicine. And, when talking to them, my nurse, April, she said, you don't want to just stop that, because it took all this time to build up that medication in you, and if you just stop, you'd be jeopardizing your health and everything like that. And that made me think, because if not, I would be in my ways. Even if it's just a little bit, it's too much for the things that I'm going through.
Mahalo nui, Kingston, for that beautiful story in sharing with us. We hope that your message will inspire and encourage those who are on a similar journey as you here in our community. So there was so much covered in this entire episode that it's time to summarize. So our first takeaway, the palliative care nurse provides the specific support one needs in managing their serious illness. Your palliative care nurse is not only your advocate or cheerleader, they also serve as your teacher. Number 2, the palliative care nurse is a partner to the patient and will help one live life on their own terms. When necessary, your nurse could also make a joint visit with you and your other specialists, like your cardiologists. And 3, the palliative care social worker supports the emotional needs of the individual living with serious illness and their caregivers. Serious illness affects the entire family. The palliative care social worker educates, supports, and provides counseling related to living with serious illness. They will also connect families to the community resources. me tell you more about our palliative care program. Who qualifies? Those with cancer, congestive heart failure, advanced renal kidney disease, advanced liver disease, chronic lung disease, also known as COPD. How are these services paid for? Palliative care, also known as kupu care, is covered under most insurance plans. You may be responsible for a copayment based on the type of insurance you have, similar to an amount you would pay when visiting a specialist. How does one know they need palliative care? Well, if you or a loved one is experiencing symptoms such as frequent pain, nausea, anxiety, shortness of breath, or depression, palliative care may be for you. Is your caregiver overwhelmed, tired, and frustrated? Are you visiting the emergency room several times in 60 days? Do you need to call your physician often? If you've answered yes to any of these, then it's time to consider palliative care. Getting the support early is key. Patients can receive palliative care at any age, ideally at the time of diagnosis. Early support can reduce anxiety and stress for both the patient and caregiver. Besides providing support, palliative care also provides solutions, such as education on managing your pain, discomfort, and nutrition. Also, a plan of care is created based on your priorities and values. Help with coordination for doctor visits and medications. Referrals to helpful services in the community, and also to ensure you have an advanced care directive. How is palliative care different from routine care? Palliative care is specialized care. While the physician focuses on the cure, our kupu care team focuses on the physical and emotional care of the patient and family, ensuring the patient's values, wishes, and life goals are at the center of their care. This holistic approach is why palliative care uniquely works. Plus, the care is provided in the comfort and convenience of a patient's home to help reduce stress, pain, and suffering associated with the illness, while also boosting the quality of life for both the patient and family. We hope this episode has raised your awareness about palliative care for those living with a serious illness. It's such an honor and privilege to spend this time together. Mahalo for joining us. This segment will air every Thursday and Sunday at 7 p.m. on Naleo TV Channel 54 throughout this month, with a new episode airing next month. You can also view this on our Hawaii Care Choices YouTube channel. Mahalo to our Ohana and friends listening over your favorite podcast channel. A new podcast episode will also be posted at the beginning of each month. For more information on this episode or to send a question for the next show, please go to our website at www.hawaiicarechoices.org or call us Monday through Friday during normal business hours at 808-969-1733 to leave your question. I'm your host, Lonnie Weigert, sending you all much love and compassion until we meet again on Let's Talk Healthcare Hawaii. Aloha, a hui ho.
Mahalo to MedQuest, Hawaii Care Choices, Brenda S. Ho, CEO, and special guests April Cao and Laura Dvorak.